I grew up watching Emergency. I started in 1982 as a junior firefighter at a little town called Remington, Virginia. So that kind of helped build my love for fire rescue even more so as it developed through the years. I had just finished a 36-hour shift at work. Came home, went for a run, and I couldn't build up a head of steam. I came in and I sat down at the table and I went to have a glass of milk, and got the glass up to about my mouth level, and boom, I had right-sided paralysis, facial droop. I had the worst headache of my life. I could think what I wanted to say, but the words would not come out. My wife looked at me and said, "Greg, stop screwing around," and then looked at my face and immediately knew I was not messing around. She's also a physician assistant, and within about 30 seconds of my onset of symptoms, my wife called 911. And within an hour, I was at our local primary stroke center. I'd had a stroke and something called a carotid artery dissection. They gave me the choice of some facilities to go to, and with my background working Richmond EMS many, many moons ago, I said, without a doubt, get me to VCU Health. We would take people in there that there's no way they're going to survive, and then you get a follow-up that they were being discharged from the hospital. We always called it the Miracle College.
The tear in the artery was narrowing it about 95%, so it was nearly completely blocked off. We used a balloon to open up the artery and left a stent in place to keep the artery propped open.
The surgical care I got was incredible, but everybody there, from the person that was pushing a broom to the food service, my nurses were leaving the neuroscience ICU, going down to a food truck and buying me a Coca-Cola out of their own pocket and bringing it back to me. So I went through speech therapy, occupational therapy, and physical therapy to recover, with my goal of not having to medically retire. And I remember telling Dr. Reeve Cantwell, if I never get any better than I am today, I'm going to be able to toast my son at his wedding, and I'm going to be able to dance with my daughter at her wedding, married this April. Even this many years out, I am still in recovery mode. And I'll actually have sometimes stroke signs and symptoms, Post-it notes. I use those everywhere to take place of that little bit of a short-term memory loss that I have. You know, I'm able to compensate and get a lot better. It's incredible how the brain can rejuvenate itself.
So recovery of the brain can happen long after a stroke, even a year or a year and a half, and Greg has done remarkably well.
After my stroke, I really wanted to return to being a firefighter paramedic again. I do a bunch of stroke teaching to emergency medical services and fire departments across the state on my case study. I've transported several stroke patients since my event, and have been able to communicate with them, "Hey, I'm a stroke survivor," and they look at you like, "You're a paramedic on an ambulance?" "Yeah, I am." I think it was just a good reset button in my life. It really let me realign my priorities. I'm happy that I had it, because it made me a better person, I feel. I have more blessings than I deserve, and it's faith, family, and friends, and the excellent medical care I got at VCU Health.